Okay, we are live. Fantastic.
Excellent.
Okay, we are live. So I'm going to come back into Zoom. Okay, so I want to welcome everyone. I think all of you know me. I'm Renee Kusky, geriatric social work and memory coach, and I want to welcome and introduce Dr. Cameron Clark. Thank you so much for joining us today, tonight, whatever time it is. I'm in Israel. Dr. Clark is in Calgary, Canada. So we're in very different parts of the world, but the fun part about this is we can all get together and talk about memory, opportunities, and challenges. If you hear some booming in my background, there's fireworks outside that I can't do anything about other than close my window. 1 second. No, the window's closed. Okay. So sorry about that. There's some fireworks going on. The city decided to do fireworks tonight for some reason. So hopefully that'll quiet down. Okay, so whoever's joining us live on Facebook, feel free to comment. I'll keep checking the comments and we'll try to address any questions that come up as we go along. So Dr. Clark is a neuropsychologist. He's in private practice. He does neuropsychological assessments and neuro rehab and a lot of memory work. So I am super excited that we found each other on Facebook, and I love to collaborate with doctors and anyone in the field that we can have the discussion and talk about what's new and interesting and hopeful and empowering to seniors or anyone that's concerned about their memory as they age. So welcome and thank you for joining me. So tell us just a little bit of background, like where you're from, what you do, why you do, what you enjoy doing as part of that. Just give us a little intro.
Sure, yeah. So I'm in Canada now. I'm born near Toronto, Canada, one of our biggest cities here, and kind of traveled around during my education through university and whatnot, and ended up in neuropsychology because I was always interested in, of course, humans and what makes humans humans and what drives us. But neuropsychology I found very interesting because it was a way of putting numbers to people's abilities, which is, on the face of it, it seems very easy to say how well can you do at a test, or what is someone's skill level or aptitude in one area or another. But when you can merge those two things, so an understanding of what drives humans and what makes people act the way that they do, mixed with a very sort of like hard-edged engineering perspective almost in terms of the tests that you might use to measure cognition, it just kind of got all my academic juices flowing. And so clinical neuropsychology is where I ended up. I did my training in graduate school here in Calgary, which is very cold, as we were discussing before we went live here. Mm-hmm. It's a little chilly for most of the year, but it's very nice place by the Canadian Rockies. And then I did my internship in clinical neuropsychology at Baycrest Health Sciences in Toronto, which is a center for geriatric care and clinical excellence in general. So what else can I tell you? Since then, I've been in, after my education, I did a postdoc in cardiovascular exercise, seeing whether or not exercise and more specifically cardiovascular exercise could reduce the risk of cognitive decline with age and also dementia.
Well, can you stop there for a sec? What did you find from that research? I want to hear that.
Yeah. And so what we found is that it's difficult to test because, as we'll get into, I'm sure, as we go through, some of the conversation we're going to have here, the process of cognitive decline in the aging process starts very early, right? And so it's almost like the more research that we get, the more we find out that it's not, let's say someone's 65, 70, 75, where they start to show the symptoms of cognitive decline or dementia. When we sort of look under the hood, so to speak, and look into people's biology, it turns out that some of those changes are happening 1 decade, 2 decades, even 3 decades beforehand, right? And so what that means is that if we were to really scientifically discover what the effect of exercise was, we'd almost have to randomize people to an exercise group and a non-exercise group for like 30 years. Right. And obviously that research hasn't been done. But the research that has been done does show very good positive effects for protective effects for exercise in terms of warding off cognitive decline and dementia in later life. Yeah.
Wow. Yeah, pretty interesting stuff. So wait, that's research you did recently, or you said when you were training? Like how long ago was that?
That I would have ended in about 2018. So I've only been in private practice for about 2 years, 2.5 years. Yeah, so I guess it's fairly recent. But I thought for me, as a neuropsychologist, you can sort of pick between being an academic, being a researcher, or being a clinician. And some people are able to do both. And that wasn't me. So I decided private practice and seeing patients was more what I was interested in pursuing. Yeah.
So I'm just curious, in your private practice, basically you're working with people that are scared that they have dementia or think they have dementia. Is that what you're doing?
Yeah. So a lot of the work that I do is with, say, people who've had brain injury, right? But more relevant to the conversation I'm sure we're going to have is I carved out part of my time to run groups on memory and aging. And that was from my training at Baycrest, the group that, kind of came from Baycrest. And the idea there is just to educate people about how memory changes over the aging process or over the lifespan. And there really is a positive message to uncover there. And I gather from what I've seen in your Facebook group that that's really your message as well, that very simply, yes, there are changes, but number two, they're not all bad. And number three, there are things you can do about it, right?
Exactly. So that's exactly what I'm getting at and what I'm working at is the things that we can do. And as most of you know, I teach memory improvement courses. And again, the message is there's so much we can do. So whether it's learning the techniques and then saying to ourselves, I have a technique I can use. I don't have to be scared for the next 20 years that I'm getting dementia, right? So when that senior moment happens, which they do, I have a technique I can use. So A, it's empowering, B, it's hopeful, and C, we don't have to let fear drive us. I feel like in many areas of our life, we let our fears drive us. And I'm trying to re-educate, retrain, bring up the awareness that that's so much you could do. So first of all, like in terms of the strategies and tips and tools and all the fun stuff that I teach in terms of remembering names and numbers and lists of items and helping with focus and all that fun stuff. And then the lifestyle factors, which you touched on, the diet, the exercise. That is definitely my message is there is so much we can do to improve our aging process. And I know we have a lot of people in my group and also that I'm in contact with in general. I don't know, I'm not sure who's watching right now, but that are caring for people with dementia. So it might be parents, grandparents, a loved one, a spouse with dementia. And it's very, very scary to watch that and then say, oh, am I going down this road also? Like, what am I going to look like in 10 or 15 or 20 years? Yeah. So I really like to empower people that even if they have a parent who has dementia, and even if they think they have the gene, that there's so, like the research today shows there's just so much we can do. And that the genes are now only, what I've heard is a third of the whole picture. Like there's 2/3 of lifestyle factors and a third is genes. You could change that if you've heard something different.
No, I mean, it's I guess what I find with all of this research as well is that the numbers in a lot of ways, the specifics of the numbers don't matter, right? If there were a specific number of minutes of exercise that you should get for brain health, I mean, it wouldn't matter that you hit that exactly as much as just being active. Yeah. So a lot of it is more in my view, it's more about like disposition than it is about like hitting specific targets, right? And I know when we're talking about like lifestyle change, we're talking about behavior change, we're talking about habit change. And at the root of things, habit change and lifestyle change are basically identity change, right? To change how you operate in the world is to change who you are. And that's a really difficult thing to do. Yeah. And so it's no small task just to say, well, it is a small task to say, you should eat well, you should exercise, you should sleep well, you should be less stressed. But actually making the improvements is a very difficult thing to do and warrants our attention, I think.
Mhm. Mhm.
So it's great to see that you've made such strides towards that.
I'm trying. I'm definitely trying.
Yeah.
When you say disposition, so tell me what you mean and how do you help people change their disposition? Like talk to us about that.
Yeah, and this is sort of the most interesting part of psychology to me is that you can, in terms of, let's say, the common psychological disorders that we've all probably had contact with at some point in our life, like depression
Hmm.
or anxiety. It was so interesting to me growing up to see people, they could work themselves into depression or anxiety, and then often the advice from the medical establishment is, and then there's drugs to get out of it. But
Hmm.
psychology kind of takes a complementary view where you can actually think your way out of it as well, right? And not that it's always one or the other, but that's the crux of psychology, is to basically take the way that you're thinking and the way that you're feeling, and to be able to move the needle just a little bit to live a better life. And that's what just keeps my interest, and has kept my interest in psychology since day one. So, to your question, how do you do it? I think the problem for memory fears as people age starts with a lack of knowledge, and maybe you could speak to this as well. But what I find is, my go-to analogy here is that as we age, we get gray hair, and all sorts of other physical changes happen, and it's a signal to the world that we're aging. And so you're not going to ask a 70-year-old person to help you move your couch or move your furniture. It's just, that's because we can see it. Um, but the changes that happen in cognition, the changes that happen in memory, don't give off signals like that. And so we can't see in our peers as we age. We can see that their hair is getting gray, maybe, but we can't see that they're struggling with memory a little bit. But we can feel that we're struggling with memory a little bit, and then we're afraid that we're the only ones, right? And if you multiply that by a whole community or a whole society, you get this group of people who are very worried about the worst case scenario and don't have the knowledge to counteract it, to say, I'm probably fine here. So I think that's the starting point. And then so for people to realize that some changes in memory are normal, and that the vast majority of people at any age group don't have dementia. That's a surprise to some people
Yeah.
as well. And then that can bring down the temperature a little bit, and then they can become more curious about what is going on, and have a little bit less anxiety about it. Is that very much what you see in your groups?
Yeah, yeah, very helpful, very helpful. Um, I actually like when people say to me, "How do I know if my memory loss is normal or abnormal?" So I actually have a freebie PDF with a checklist that I send out to people. But
Yeah.
the one I say, like, I boil down to one question. The one question is, am I functioning? Like, is it intervening or disturbing my daily functioning? So if once in a while I can't find my keys, that's not dementia at all. But if I cannot function because I can never get to an appointment on time because I can never find my keys, I can't even, find my planner where I wrote down the appointment.
Mm-hmm.
So then I'm also not diagnosing dementia there, but it is a sign that something's not going right and it's intervening with my daily functioning. So if you're functioning fine with your annoying memory losses, so I tell people, like, that's come to my courses, like that's what I do.
Yeah.
But if you're more concerned because you're really not functioning independently because of your memory loss, then I say go to a neurologist, go to a geriatric doctor, come to me for a memory assessment, have it checked out.
Yeah.
So it really depends on, obviously memory loss is a whole continuum. Normal and abnormal on anything is a continuum, right?
Yeah.
So I don't like to normalize, I don't mean to normalize real dementia. I don't mean to take away from the pain of people that really have dementia. But like
Yeah.
you just said, a lot of people are operating out of fear and they're just scared that they have dementia.
Yeah. Yeah. Absolutely. And that fear is, I have seen it range from mild annoyance,
Yeah.
right, to a handful of people that I've seen over the years. It seemed like a crippling anxiety.
For sure.
And so maybe anecdotes would be helpful. Like I have seen people that have come to my course, and I can't remember the structure of your course. It's several sessions over.
It's 12. It's over 12 weeks, 18 hours. It's a
Okay, right. And so mine would be about half the length of that, over 5 weeks. So it's a little bit less time to see people, unfortunately. But I've had people that have come up to me, say after one of the sessions, and say, I am so afraid that I have dementia. And the main reason will be something like someone in their life has told them, you're slipping. Mm-hmm. You're not who you used to be. You're not remembering the things that you used to remember. It's all downhill from here. And we're going to have to look into, other options for your living arrangements. And I could just see the fear. And I'm thinking of 2 or 3 people in particular, and the fear in their eyes. And they don't know what to do about it. And they can't get good information on, are they okay or are they not okay, from the media. They can't get it often from their physician, unfortunately, because they're not specialists in cognition.
Right.
And then over the course of my short 5-week program, they get to understand that other people are experiencing the same things that they're experiencing. They see the hands go up about, who's having difficulty remembering this or remembering that. We do a couple tests, just short tests to show what this type of memory is or something like that. And then in a number of weeks, they're feeling so much more relaxed about their ability. And in all 3 cases that I'm thinking of right now, those people had such a sense of empowerment after just having the information and seeing that other people were struggling with what they're struggling with, that they said that they actually started to remember things more on a daily basis. All 3 cases that I'm thinking of.
Sorry, I'm just checking the Facebook for comments. That's why you
no
heard
problem.
that.
Yeah. Okay. Better than fireworks, right?
Yeah, no, the fireworks stopped.
Good.
Sorry about that. I was just checking for comments, but there are people watching, but I don't see any comments.
Yeah, and I'd encourage people, if you have questions or comments, to absolutely just dive right in and give us something to talk about. If that's, if they have burning questions, it's better that we're answering questions than just sort of talking about our own experiences, right?
But I'm curious, I actually have 2 questions for you.
Yeah.
First of all, so what do you do with when you feel someone really does have dementia? Let's say someone comes to your group and you can't allay their fears, which we're able to do a lot of the times, but then sometimes there is someone that we say, okay, I know, we know we're looking at dementia. So what is the next step? What do you do with them?
Well, and this might vary from place to place. So in Canada, what we would do is just, we would have a conversation with that person outside of the group environment, right? So maybe you've experienced this as well, but sometimes what will happen is that people will make the same comment over and over in a group, or they'll ask the same question over and over in a group. And then for people like you and I that see a lot of people and a lot of people of different abilities, you kind of get the sense that, maybe there is something here, right? But maybe there's not. Really, maybe there's not. And that's why, I always think when you test something, when you test for something, you're testing because you don't know what's true, right? And so if you, for these people, you would refer them to their family physician often to say, let's get a good handle on what's going on for that person medically, because there could be any number of medical conditions that can cause memory impairment.
Yes.
Right. So just because someone is showing decreased memory ability beyond what you'd expect from the normal aging process, it doesn't mean that it's dementia. And so number 1 is let's get a good medical screening, and then that physician can recommend neuropsychological testing or a neurology consult or something like that. But it definitely starts by having that conversation with the person and gently nudging them in that direction.
Yeah, good point. You brought up the other causes for dementia, or the pseudo dementias, as we say. There are so many. There are so many. I'm just thinking of like a bunch. I mean, I know I have one client who has real sleep issues. Like he really doesn't sleep. Now he knows his memory loss is coming from his lack of sleep. And I've been working with him to try to get a handle on it. He's having a hard time. He's really struggling, but he knows that poor sleep causes poor cognition, right? He's very aware of that. So there's things like that. There's things like infections and depression can mask as dementia. So many different things. So yeah, what you're saying is really important. So even if someone thinks or is sure they have dementia, you want to go to a doctor who's going to really make sure to tease out anything physical going on or mental health issues that could be masking as dementia.
Yeah.
Depression and dementia have some overlapping features, so it can be confusing sometimes.
Yeah, absolutely. The three that they always need to differentiate are depression, dementia, and delirium,
Right.
right? They have different indications and different courses over days or weeks or months, right? Like depression is
Yeah.
reversible, but something like dementia is not.
Mhm.
Whereas delirium might have like a shorter run in a patient. Um, but yeah, that's step one because those are the easiest fixes, so to speak, right?
Yeah.
And so whenever I'm talking with patients, I often use analogies to like getting your car fixed
Mhm.
because I come from a family of mechanics.
Mhm.
And so that just it seems to work for me, and it often works for patients because it's something physical, right? It's tangible. So if there's a problem with your car and there's any number of causes, you'd look for the easy fixes first,
Right.
right? You wouldn't sort of tear the engine out and start from there because that's sort of like a last case scenario or worst case scenario. So a medical evaluation is absolutely number one. See if there's anything causing it, and then that physician can decide if they haven't found anything, then it's time to move on to the more um, harder to detect causes like a neurodegenerative condition or something like that.
Mhm. Mhm. Can we talk for a second about TBI, traumatic brain injury, which I think you mentioned before?
Yeah,
Um, just I used to think like, oh, who has a TBI? But then when I started working with this, I'm like, it's coming up right and left.
yeah,
I had someone take my course who, at the age of 25, had a terrible car accident. They didn't think she would live. She's now
yeah.
65, and she had a TBI, traumatic brain injury, and
Mm-hmm.
she had a mother with Alzheimer's. So she was like really going crazy between her TBI and the mother with Alzheimer's. She was sure she was headed for trouble. She did my course, and at the end, she was so hopeful. It gave her so much hope, and it's like, this is why I do what I do. If I could give someone like that hope. So when obviously if she was 65 and a half when she was 25, so that was 40 years ago. 40 years ago, things were a little different in the neuropsychology and rehab, research and practice. So of course they told her she would never X, Y, and Z again, whatever. And she did. And she went on to lead a very productive life and had a very smart job and
Yeah.
very bright lady. So can you just talk a little about TBI and rehab, which I think you do, neuro rehab, you have some experience with. Just give us some hope about that.
Oh, certainly, yeah. So the vast majority. So just to clear up some of the language too,
Yeah.
what often gets confused is something like traumatic brain injury versus like concussion.
Yeah.
And those terms in the scientific literature are used rather interchangeably, which is good. But just so we're on the same terms here, maybe concussions are sometimes referred to as mild traumatic brain injury, where
Okay.
traumatic brain injury might be something more significant, where there was, say, loss of consciousness for 30 minutes or more, or if there was physical damage to the brain or the skull or something like that.
Mm-hmm.
But in general, the more severe the brain injury, the less of them there are generally. So the vast majority of brain injuries are of the minor variety. And the good news there is that they tend to sort of clear up within 3 months. It's always hard to put a time frame on things because there's, I would tell patients that are at the say 4 or 5 or 6 month mark after a concussion or a minor traumatic brain injury, and they're still having symptoms. So like headache, dizziness,
Mm-hmm.
sensitivity to noise, sensitivity to light, all those kinds of things. I'd say, most people would be in the clear by 3 months, but you're in good company if you're not yet, because lots of people still have symptoms beyond 3 months. Um, but there is a good overlap in strategies for people that are experiencing fear of dementia or cognitive decline and people who have had brain injury. So a lot of the strategies that we would use for helping people with memory, they work quite well for people with traumatic brain injury. Um, often, and I'm sure you find this in your groups as well, often the difficulty is maybe not even so much with memory, but with attention,
Mm-hmm.
right?
Definitely.
Are you thinking of some people right now where you see their attention kind of wandering all over the place, and then they say, I can't remember anything?
Right. Exactly. Yeah.
Yeah. And so I think that happens in brain injury a lot, where it's not just the impact to the head, it's all of the things that go with it. So it's maybe they're not working anymore. Maybe they're not working as much anymore. Maybe their relationships have changed. Maybe they have medical appointments once or twice a week now. So it's a huge disruption to people's lives.
Yeah.
And all of that factors into their ability to pay attention to the thing that they're supposed to pay attention to.
Yeah.
And so it's that anxiety and attention piece as well that's very important for those patients.
But with traumatic brain injury, in this day and age, there's a lot that's, I don't know, do we say everything's reparable, or definitely a lot is reparable with rehab and time, and like we believe that a lot of the brain can be repaired. Things that are damaged, right? Things that are damaged, we believe. I don't know percentages of what could be repaired, but I know that we believe in neurogenesis and neuroplasticity.
Yeah. So it's certainly the case that people can experience injuries to the brain that will last their whole lives. That's possible, right? Okay. But the majority of concussions or mild traumatic brain injuries, what we see when we test for things like attention, memory, ability to plan, language, processing speed, all of the things that a neuropsychologist would test, they tend to go back to baseline. They tend to revert to where they were before the injury, even if people don't feel like it. So people can often say, I can't remember as much as I used to, but when you test them, they're as good as they would have been before.
Well, that's right? Interesting. Wait, so what explains that?
Well, there's a couple things. So there's often what's called this like good old days hypothesis, right? Yeah. I'm not sure if you've heard that before. So people tend to remember things in the past a little bit more fondly sometimes than they in fact were. And so I've had people come in and they would say, when I used to read a book, I would remember every word of it. Mm-hmm. And now I can't remember anything. Mm-hmm. And in my head, I'm just thinking, like, not possible. Like, there's no way you read a 300-page book and remembered every word of it. But there just seems to be that disconnect where people want to say, I know I'm feeling terrible, and there needs to be a good reason why I'm feeling terrible. So I'm going to adopt this view that I used to be better than I am, and that's almost helpful in a way, right?
Yeah.
Are you seeing some comments there?
I'm seeing one comment. Okay, it says, people with MS can have cognitive issues. Could you address this? I assume she's talking about MS as in multiple sclerosis.
Yeah, absolutely. That would be one of the conditions that MS sort of strikes, I don't want to say randomly in the brain, but it strikes different parts of the brain and with different severities, right? So there's different types of MS. I think there's, you could have a relapsing remitting pattern where it kind of comes and goes, or a more stable pattern over time. And so in those cases, it's very individual, right? What kinds of things are affected. But in that case, what can be helpful is having a full neuropsychological assessment so we get a good understanding of where people are at, and then you can look for changes over time. And so that's kind of the best way to address that when it can be so individualistic. Having a good baseline is paramount.
And in those cases, not just MS, but I'm thinking of a lot of different things. Is the recommendation basically to just keep very active cognitively, like keep challenged, keep stimulated cognitively, physically, socially? I know that sounds like a lot that I just said, but really not giving up, not giving in, going back to that disposition thing that you were saying, and just keep very, very active. Is that like in one, if you have to say one sentence, is that what you would say?
Well, what's funny? So I'm thinking back to my time on internship, and you're right. You nailed all of the things that people should be thinking about in terms of improving long-term brain health, right? Eat better, sleep better, stay cognitively engaged, stay socially engaged, reduce your stress, all those things, right? And one of my co-interns, the person who was an intern with me, he basically would sum all that up, kind of joking, but he was right. He'd say, well, so to avoid dementia and cognitive decline, you just need to have a better life, right? But like those are the things that actually do help. And so those are the things that you can point to. But it does help to make small steps towards those things every day, right? And better yet, if you can take some of the decisions out of your schedule, right? So for example, if you wanted to eat better, rather than just telling yourself that you should eat better and hoping that it happens, you can really work on building systems to help yourself eat better, right? So one of them might be, don't buy those junk foods in the first place, right? Then you don't have to continually keep testing your willpower. Or something like to sleep better. I'm not sure for people, it's not always a problem, but often having a cell phone or electronics by the bed can really keep people up, right?
Yeah.
So making systems that help form better habits is a good place to start.
Love that. And I want to just quote Jim Quick, who says, we create our habits and then our habits create us. I love that saying. We create our habits and then our habits create us. Yeah. You know, if every single day you wake up and go for a walk for 20 minutes, it's just moving. You just move for 20 minutes just to start your day. Or even if you get up and just march in your bedroom just to get moving. That is a habit that is a very big difference between someone who sits on the couch all day and someone who goes out for a walk every morning, even if it's 20 minutes, right? And even if it's not intense. It's a difference between sedentary and not a sedentary.
Yep, absolutely. And exercise is, I always put a bit of an asterisk beside exercise on that list of, diet and social engagement, cognitive engagement, because there's no silver bullet, right? There's no magic potion for brain health. But if there was one, it's exercise. Like that's the closest thing that we have, right? If we could put exercise into a pill, I'm sure we'd prescribe it to everyone. So another good way to think about it is whatever's good for your heart is good for your brain. I'm not sure if you or your group has seen the picture of the vasculature of the brain. So there's this really interesting picture where they sort of somehow they were able to get rid of all the brain tissue except the vasculature, except the veins and arteries. And it basically looks like a fully formed brain because there's so many vascular structures in the brain that when you remove all the other tissue, it's almost like that's a big portion of the whole brain, which really highlights the importance of keeping that system in good operating health, right? And the way to do that is to keep the blood flowing and to keep moving.
Yeah. You're welcome to post that in the group if you think it'll be interesting to people.
Okay. Yeah. I'll find that photo.
Dr. Clark is in this Memory Matters group, so you can post whatever you want that after this talk you think will be interesting to people.
Yeah, I'll try to do them.
We actually have a range of ages in the group and from all over the world. So it's really amazing. We have over 500 members now in the group. And really from South Africa to Tucson, Arizona, Israel, Canada, all over.
Well, you've tapped into something very important, right? And I think it's almost like I heard this from one of my supervisors years ago. They said talking to seniors about memory is almost like talking to teenagers about sex.
Yeah.
It's almost like this, oh, we don't talk about that because there's too much on the line, right? And so I think having your group and it draws people to it because it's a thing that people really want to know about.
Yeah.
Which is fantastic.
And there's so much, and I feel like there's so much that can be done to improve your memory as you age and to age more healthfully, cognitively and physically and mentally. It's like, we need to share, we need to share what we know. All of us, we need to share what we know in terms of helping people with their memory.
Yeah. And I guess one of the things I struggle with in my group is conveying the message that there are things you can do, but they all take effort.
Yeah.
Right. And so there's no pill that you can take that's going to just immediately improve your memory or your cognition. And when you tell people some of these strategies, like, some that I would mention in my group would be things like writing things down.
Yeah.
You almost get this sort of collective eye roll, like, well, I know I can do that, right? But it's almost like as much about motivating people to do the things we know work. Like that's the magic sauce, is not like, here's this secret that's been kept from you for centuries. It's just, you have to do it. Yeah. And that's where the rubber meets the road, right?
Yeah, definitely. If you could give what's your best memory tip? Like, give us one really good memory tip that you love to give people that could help people right now.
Honestly, I think for the people that I see, and I'm gonna guess it's the same for the people that you see. Mm-hmm. They're very like the people that would join a Facebook group, the people that reach out to people like you and me about difficulties with memory. They're type A people, right? I don't know if that reference travels, but they're very sort of anxious people. They're very driven people, often very successful people, and they notice very small changes and they're worried about it. So my number one tip is always relax, right? It's just like, let's bring the anxiety down a little bit. And if we can take your attention off of what you think is the problem, sometimes the problem tends to disappear or at least diminish a little bit. Mm-hmm. So that's not true of everyone, right? Like if someone had been in a car accident and they have memory problems, my advice isn't just relax. But for the very anxious people that are noticing very small changes in memory, I think relax is a good place to start. Yeah.
Yeah. So I always tell over this great story. I was teaching my course and there were about 15 ladies there, and probably the oldest one came back to me the second week after I taught the technique of just taking deep breaths. When you start to panic about forgetting, first thing I say is take a couple deep breaths. It brings oxygen to the brain. You're going to recall better. Yep. So she comes back the next week and tells me this story. She says, I was walking with my 19-year-old grandson, and we were trying to remember the name of a neighbor, and neither of us could remember the name of the neighbor. Okay, this woman's probably in her 80s. Okay.
Yeah.
And then she said, I took a couple deep breaths, and boom, I remembered the name before my 19-year-old grandson. Now, she was so excited that she remembered first, and she was so excited that the breathing helped. I was also very happy that this worked for her. And I also said to her, this is not rocket science. This is not the most sophisticated technique I teach. But I was so happy that something as simple as a couple deep breaths really did clear her brain fog, really did relax her enough, and did bring oxygen to the brain so that she could remember. So it was just funny because I'm like, I'm glad it worked, but like I have much better techniques than that.
Yeah. Well, and sometimes that's all that it takes, right? It's just, it's amazing how much people are able to bend themselves out of shape with worry about memory. Yeah. And just like I said, bringing the temperature down a little bit, bringing the anxiety down just a little bit can make a world of difference. And it's almost like it's like this positive feedback loop. The more anxious you get, the more you'll forget. And then the more you forget, the more anxious you get. And so these groups that we're running are, in a way, they're a bit of a circuit breaker for that, right? They're a bit of a, let's break that cycle of increased anxiety and decreased memory.
Yeah, I love the way you just put that. That was, I love that. Yeah, circuit breaker. I like that.
Yeah, it just, so many of our behaviors are like that, where they're just positive feedback loops. And by positive, I don't mean like good for us. I mean that just one thing influences another, and then it continues in a cycle. And so a lot of psychology is meant to sort of break that that cycle that's often causing harm to people.
Yeah.
And in a way, I almost feel like, with these memory groups, some jobs, some job descriptions require effort to convince people of things that may not be true, like maybe, present company excluded, but like used car salespeople, right? You have to really be aggressive about like drawing people's attention to certain things. But for what we're doing in educating people about memory, there really is this positive message there. Yeah. Like I don't feel like a used car salesperson when I'm talking about memory, because there just is this helpful advice and the positive message there to give that people just don't know about. And so it's very rewarding in that way.
Oh yeah, I agree 100%. And we can prove it. Like through our work, we see people walking out feeling less stressed, more confident, less fearful, more hopeful. We see it. And so, yeah, it's quite rewarding.
Yeah.
Tell us a little bit more about the group/courses that you had told me in the past that you were running. Are you currently running any of them?
Well, I had shifted to, I mean, COVID has changed
Right,
everything, right? And
right.
so I had done a bit of a push in maybe May. When COVID hit Canada, it was March. Was that the same in Israel?
Yeah, yeah,
Around there, yeah.
yeah.
And so
Like
everything kind of
March
shut.
18th or something like that.
Yeah, we were booked like right through 2021, and then all of that was scrapped, unfortunately. So we moved it to online, and everything's been slow to change. So I haven't run a group since the start of COVID, but it's looking like people have they've had enough of this, and they want to get back to at least doing some of these groups online. And so I imagine 2021 will fill up again with online groups. So it'll be interesting to see how that translates, because I really think a big benefit of the group was that people could socially reference other people, right? They could say, oh, that human, that real human over there that maybe I've seen in the community is having the same problem that I'm having. Mm-hmm. And I very much hope that that translates to the online setting. And I wonder if you have any insights about that.
So I've been part of and done a couple support groups, different types of support groups online, and they're great. It depends exactly what and who, and if it's cohesive and confidential. We've taken a lot of stuff online. One of the support groups I ran, I couldn't do online because the women, it was like spouses of people that were not well, and the spouses didn't feel like they had enough privacy and confidentiality in their homes to do those support groups. So that's what I hit up against with one of the support groups I was running. So that we haven't continued, unfortunately.
Yep.
But some of the other groups, we've been doing a lot of them online, and we do the best we can. It's not the same as live, but it's as close as we can do right now.
Yeah, it's the only real safe option, right?
Yeah.
Yeah. So what I'm finding is here in Canada, Canada's pretty big. So in my area, a lot of I'm getting a lot of interest from sort of either municipal recreation coordinators, right? So they'll say, we'd love to have you in for like a 1 hour session just to speak about memory and all that kind of thing, which sometimes leads to people signing up for the course later on. But less interest from individuals, just say from my website or something like that, right? But I'm thinking it's reassurance about memory is almost something that's like sneakily useful, right? And so I'm almost wondering if it might be worth my while to change things so that people are able to sort of have access to the course and then worry about anything payment wise later. But it's all, it's in my head for now. I have to think about how to implement that.
Right. Okay. Can you tell people that are watching how they could reach you if they're interested in following up with you? I assume you do assessments virtually, right?
Well, I would do like psychological assessments can be done virtually, but unfortunately, some of the things for a regular neuropsychological assessment, they have to be done in person, which is really inconvenient right now.
Yeah.
But it's because we have decades of research on these techniques that were never designed to survive a pandemic.
Right.
We're stuck with it for now, right? And so we're in this weird situation where even if the neuropsychological assessment is really important, it's still really important to do it the standardized way. Right? But for anyone watching or listening right now, the most interesting thing for them might be to check out my website. So I run sharpthinking.org. So just all one word, sharpthinking.org. And most useful on there might be, I put out a weekly newsletter where I write about just a 2 or 3 minute read on either a memory strategy or a tip about mental health, or a section that I like called Tools for Thinking. And so just sort of a little bit of everything related to human beings, cognition, memory, and kind of how to think about things. And it's free to sign up, and I write weekly, and I hope people like it.
Okay, right now I just typed into the comments www.sharpthinking.org. That's what you said, right?
Yep.
Great. So I just typed that in so people can click on that.
Yeah.
This is so fascinating. I feel like I could just keep talking to you and picking your brain. But I think we gave people a lot to think about tonight. I don't see any other comments. There are some people watching us live, so thank you for joining us. If anyone has comments, please put them in the chat now and we'll try to address them. But Dr. Clark is on Facebook and you can check out his website, and he can post in this group whatever is interesting. If you have any interesting research that you want to share with us, feel free to post it in the group.
For sure.
I'm just watching for comments. Sorry. Okay, I don't see any other comments. Oh, wait, 1 second. Someone. Okay, someone wrote 2Ks question mark. Oh, sharp thinking. Oh, because I typed it with 2Ks. No, it's 1K, right?
Oh, yeah.
Sorry. Thank you, Patty. I typed it in wrong. It's sharpthinking.org with 1K. I just made a typing mistake. Sorry about that.
And yeah, feel free to subscribe to the newsletter. It's super short every week. Should be good to give you something to think about. And you can always unsubscribe if it's too much email or anything like that. So
fantastic. So that's a weekly email with different memory tips.
Memory tips, but also, well, I mean, just for example, I could run you through just a couple of the things that I've written about, like that just interest me, that are at the intersection of memory and the aging process and just thinking in general. So one of them that I really liked was called Via Negativa. So it's this like, so Via Negativa is like via as in like the way, and negativa as in like subtracting something. And so the idea is like addition by subtraction. So if we're thinking about like having a healthy diet or having healthy sleep or any of the other lifestyle factors, right? Often we think about the way we need to do that is by adding something, right? We need to have a healthy diet by adding blueberries, or we need to have a healthy diet by adding antioxidants, right? All these different sort of buzzwords. But often the solution is by removing something, right? And I think that goes, it's a way of flipping that sort of typical way of thinking about things on its head, so people have another perspective.
Yeah. Like so you're talking about, like, for example, like removing sugar, right?
Yeah. We often go about looking for solutions by adding things. We need a product, we need a service, but in a lot of ways, a lot of benefit can be had by removing things from our habits or our routines. Yeah. So there was one on that. And then another really blog post that I quite liked was on attention. And I think I'll write about this a lot. But it's just the idea that really the quality of your attention defines the quality of your life, right? If your attention is scattered, you're really not giving yourself much of a hope for making sense of anything. And so taking stock of what we're paying attention to is a very basic and easily achievable step. Yeah.
Attention is a huge one. I do a whole thing on focus and attention and multitasking, which we're all doing all day, and it's not good for us.
Yeah. And we're pretty bad at it, right?
Yeah, exactly. Yeah, yeah, I just launched my membership program. It's a 3-month membership thing, and it's 12 short videos. Each week I send out a short video and a brain exercise. 4 of those are on focus and attention.
Yeah.
Because it's a really important part of memory.
Yeah, absolutely. It's almost like I tend to think of attention as like the gatekeeper of memory.
Yeah.
Right. So you can't, well, one of my favorite anecdotes from the course, this lady was saying, giving us an example of the kinds of things that she would forget. And so she'd say, well, I'd be on the phone with my friend, and my friend would tell me the date and the time of the party or the get together or the gathering. back when we were allowed to have those.
Right.
And she'd say, and I can't for the life of me ever remember what she says. So she'll say, Sunday at 6 o'clock or whatever. And she said, I just can't remember. And so then we were kind of troubleshooting this in the group, and we said, well, what are you doing while you're on the phone? Mm-hmm. And she'd say, oh, well, I'm doing the crossword, obviously. Right.
Oh my God.
And so, yeah, but then, and that's so common that people can take something like that and they'll say, but my memory is bad. And so there's just that education piece about, if you think about what's been done here, your gatekeeper was keeping out all that information, right? You didn't even give your memory a chance to hold on to that. And so just pointing that out, a couple of weeks later, she was like, now I'm paying full attention when I'm on the phone, and it's fine. I can remember whatever I want. Yeah. But people really do need that little tip, that little instruction of, attention first, memory comes next.
Right.
Yeah.
It's huge. The multitasking really trips us up. And I always say that's why there's such a huge fine for driving while talking on a cell phone. I don't know what it is in Canada, but here it's like 1,000 shekel, which is like $250, and 8 points on your license, because it's so dangerous. Our brain cannot actually drive and talk on the cell phone at the same time and hold the cell phone. So it's, we think we can. We were brought up thinking that we can do a million things at once. Yeah. But it causes so much stress, and it like totally like makes our brain go in a million different directions. And then we want to know why we can't focus on anything.
Yeah. But and I guess what's important to notice is that the modern world, and not just modern as in the last like 100 years, but modern as in the last like 20 years, has really accelerated the demands on our attention.
Yes.
Right. If you think of podcasts, I know some seniors love podcasts, some seniors don't want anything to do with them, right? So it's a bit of a mix there. But that was the thing that didn't exist a handful of years ago. Yeah. All of the notifications that come through your phones or smart devices, it's incredible how much our attention is pulled at and pushed around these days. And so I think back to this idea of like via negativa, a lot can be gained by cutting things out.
Yeah.
Right. So if you have an iPad or a phone with notifications, there's nothing saying you need to leave them on. Right. If you're finding that it's distracting you from your day, you can take control of your attention by designing your environment in that way. And that's huge.
Exactly. Excellent. Yeah. Wow. A lot to think about. It's really this. I find this whole thing very, very fascinating. And
you're in the right line of work.
Yeah, I really appreciate your expertise and your time. And I am sure that the people that are on really enjoyed this. And I'm sure a lot of people will watch this in the replay. If you're watching the replay, feel free to write your name and do #replay so we know you watched it. And any last comments or questions for me, or? Let's see, I'm just checking. I'm going to check one more time to see if anyone has any questions on Facebook. I don't see any other questions on Facebook. Any last questions on Facebook? Last chance. Actually, it's not your last chance. Even after we finish, you could put a question and we'll try to answer it.
Right. That's right.
Okay, so I'm going to ask you one last question.
Yeah.
Let's see, you told us how to reach you. You told us, let's see. I guess I'm going to ask one more question. Tell us just one story of like a huge success where you felt really rewarded or really good about doing what you do. Just one story.
Yeah, I would have to go back to, there's so many people after the course that say, all the things that we've kind of alluded to here, like it was so good, I feel better, I feel more confident. But I'd have to go back to those 3 people that I'm thinking about in different courses where I really felt like their life would have taken a different path had I not been able to speak to them about memory.
Wow.
Right.
Wow.
I don't know that that's true, but I feel like it might be. And that's the kind of thing that keeps me motivated to run these groups, is just that I don't think there is another information source that can accomplish that end, that good outcome for people. And so I know it's a little bit tricky to, the nuts and bolts side of things, like to monetize it, to make it a full-time job, to make it worthwhile to run. But I really think that those are important things to work out so that people can have this information. And especially with an aging population. Here in Canada, we filled, it was in a hockey arena that we did it, just like a conference room in a hockey arena. But I feel like we need to fill stadiums. This needs to be courses like yours and mine are like, they're the user's manual to the aging brain, right?
I like that. The user's manual to an aging brain.
Yeah, well, isn't it? Like, I really think it is. Like, our bodies change in a way with age that is obvious, and our minds change in a way with age that is not obvious. And we need to have these things in place, but it's so hard to convince people of that, right? So I think you and I think this is good work to be doing, and it's really important.
It's very powerful. What we were just saying before is very powerful. The impact that we can make on people, and it. I always say it does increase the quality of life. It increases the quality of life when you can age with more confidence, self-esteem, and belief in your memory. That is qualitative. People are living longer. They just are. The number, right? So many more people are living longer. But we want the quality of life to go along with that.
Yeah, absolutely. And to have people not feel like they're constantly dodging dementia.
Yeah,
right?
Exactly.
One other thing I wanted to mention, I guess, is, sometimes when I answer people's questions in the group, I feel like I do an okay job. But you know how sometimes when people ask a question, you feel like you nail it, right? Well, there was one example of that. And it was a lady who had asked, she said, my sister had dementia and my mother had dementia, and I really feel like I'm next. And what would you say to someone like me, who, I hear what you're saying about the diet, the exercise, the sleep, the stress, all that, but like, what if you really think you're going to get it, right? And I was just, at that moment, I was reminded of a quote from Bill Clinton, right? The former US President, Bill Clinton. And he had this great idea. He said, when you're faced with a difficult problem, right? A problem that might have no solution, the best thing that you can do is to get caught trying, right? And that, I think, is a bit of wind in the sails of people who feel like it might be helpless. But it's like, get caught trying, get on with doing these things that will be helpful. And you can't control the outcome, but you can control the inputs here, right? And that's all that's within your control. So go ahead and control them. And that was,
get caught trying to solve the problem.
Exactly. So same thing with cognitive decline and dementia. Get caught trying to sleep better, get caught trying to eat better. You're not always going to succeed, right? You're going to have that bag of chips or whatever it is that's your Achilles heel, but get caught trying to do better.
That's great. I love that. Love that. Well, I hope that everyone watching got some good information, a good positive message, hopeful, some hope. And I think this is like really, really fascinating. And I really, really appreciate your time and expertise. I look forward to seeing more. You can, again, post in the group. Feel free to, if you have any upcoming events or whatever, feel free to post them in the group so people know about them. If it's virtual, and we can join virtually.
Perfect.
I don't know how many people in this group are actually in Canada. But yeah, I'm sure there are some. I don't think the majority are in Canada, but probably the majority are in the United States. But we're from all over. So yeah, I really, really appreciate your time. It's so fascinating, and I wish you the best of luck.
Likewise. Thanks for having me on.
I hope everyone stays well. I'm going to end the live stream now onto Facebook. 1 second. Stop.